Hello.
Yes,
Hello.
hello.
Yeah, hi.
Hello, good morning, ma'am.
Good morning. Okay, so a couple of questions.
Yes, ma'am.
So I've kept my phone in landscape horizontal. You want me to keep it this way or you want me to change the position?
It's fine.
Okay, so is my head coming cut from here or do you want me to raise this further?
Yes, I can just see till here. So if you can adjust it a bit, like if you can slant it a bit.
Okay.
Yeah, now it's better.
Is this better?
Yes, ma'am. Now it's better.
कौन सा ऐप यूज कर रहे हैं आप लोग? Same
Ma'am, this is Google Meet for recording.
No, for transmitting onto YouTube.
That I'm not aware. We have some support from the computer center. They are taking care of.
Okay, fine.
Yeah.
Am I audible enough or do I need to use any gadget?
No, ma'am, you're audible.
So I don't think recording is on so far, right? We are backstage.
I have switched it on, but I've just started the recording.
You start the recording when you're formally on, so switch it off.
Yes, I stopped it.
Yep. So when you say get set go ready for everybody, that's when you start the recording, so that everybody is already logged in and everybody has been given instructions. Right? There is somebody whose audio is on and is messing up with others' audios.
Okay, I'll just.
आपको एक बात और बतानी है. आप अभी मैंने आपसे बात करी थी फोन पे क्या?
Yes, ma'am.
तो मैंने डॉक्टर सौराब के नंबर पे एक वीडियो भेजा है.
Okay.
आपको मिला है?
जी. He has sent me.
हाँ, ये YouTube पर है. आपके पास तो शेयरिंग राइट्स होंगे.
Okay.
जब आप मेरे को टॉक पे बुलाओगी,
Mm-hmm.
ठीक है, तो मैं आऊंगी. मैं 2 शब्द बोलूंगी. 2 शब्द बोलने के बाद मैं आपको रिक्वेस्ट करूंगी कि एक बारी इस वीडियो को शेयरिंग मोड से प्ले कर दें. ठीक है? ये वीडियो हम जो ब्रेस्ट कैंसर पे एक्टिवली काम कर रहे हैं और मैं आपके साथ भी विमेन डेवलपमेंट सेल में जुड़ी हूँ, तो ये वीडियो एक्टिवली हम जो काम कर रहे हैं उसको दिखा रहा है. और हम एक एनजीओ के साथ जुड़ के काम कर रहे हैं. ठीक है? और फिर जब मैं अपनी स्पीच दे लूंगी, खत्म हो जाएगी, तो मैं आपको एक बार और रिक्वेस्ट कर दूंगी, आप प्ले कर दीजिएगा.
ठीक है मैम.
मेरे शेयरिंग राइट से बेटर तो आपके पास ही है और ये YouTube पर है.
Okay. We'll just wait for 5 minutes for all the participants to join in.
Are you guys using your computer? All of you? Khurshid ji, Shamsi ji, aap?
Yes, ma'am. I'm using my desktop.
Desktop.
Yeah.
Because मेरा ऐसे आ रहा है ना, ऊपर का नीचे का कटा हुआ.
No, it's
तो
okay. ma'am.
landscape
नहीं.
में, हाँ,
No.
Your picture is perfect.
मेरे में
Yes, yes,
Yeah.
कटा हुआ आ रहा है ना ऊपर का
No. It is full.
अच्छा पूरा आ रहा है.
Yeah.
गुड. अच्छी बात है जी.
You're absolutely
to adjust.
नहीं, यहाँ पे मुझे दिख रहा है ऊपर नीचे कटा हुआ है आज, तो इसलिए मैंने पूछा आपसे.
In our view, it's really perfect.
हाँ, और मैं फोन पर ही करती हूँ, अपने एप्पल के फोन पर ही.
Ma'am, yours is fine. And like we can see you properly. I have kept your video on one tab, so whenever you will ask me to share, I'm going to do it right away.
Sure. You can universally ask all your participants to keep their cameras off, and you can disable their mics. You have a central control. You can enable the mic of whosoever you want to, so that there is no ambient noise. Also, whosoever is speaking, क्योंकि यहाँ पे मैं pinning of tags नहीं देख रही हूँ. For example, मैं बोल रही हूँ, आप बोल रही हैं, आप बोल रहे हैं, तो आप अपने को पिन करके केवल अपने आप को विंडो पे ला सकती हैं. इस वक्त हम 8 लोग दिख रहे हैं मेरी विंडो पे, तो जब मैं बोल रही हूँ तो आप मुझे भी पिन और अनपिन कर सकती हैं. आप मास्टर कंट्रोल में हो ना.
Yes, I'm going to take care of that. That whoever is talking will be pinned, and accordingly we are going to record. I don't know. Somehow your camera, ma'am, flipped.
Even there is an option that if you pin yourself, then you can be looked into a broader picture.
Yes, sir.
We ought to begin, should we? We should begin, shouldn't we?
Ma'am, we can start and
We are quite behind schedule.
Joining in. Yeah. The students will keep joining in. We can start.
Please start. And anyways, it's a recorded session. People can watch on the link later.
Yes. So I'll start the recording now. Waiting for it to start recording and then I'll start. A very good afternoon to one and all present here. I, Seher Zaidi, member of the Women Development Cell, on behalf of the Chairperson of Women Development Cell, Professor Dr. Yasmin Shamsi, welcome all of you present here and our distinguished speaker to the lecture in the form of a webinar on the topic Self-Breast Care and Breast Cancer Awareness. I am elated to invite to you our distinguished speaker, Dr. Pooja Diwan. Ma'am is a multifaceted, multi-talented doctor. She is a gynecologist and obstetrician specializing in infertility test tube baby treatment and laparoscopy keyhole surgery. She is a motivational speaker with deep roots into social service. And to the surprise of many, she is a renowned singer too. I am glad that I was able to hear few of her recordings on YouTube, and it was absolutely a delight. Ma'am is the Chief Consultant at Apollo Fertility Specialty Centers for South Delhi and Noida. She is the founder of Arcady Life, a healthcare service catering primarily women. She has more than 20 years of experience in this field. She is a fellow of the prestigious Royal College of Obstetricians and Gynecologists at London, and she represents Outreach Committee of NARCI Delhi chapter. Dr. Pooja recently featured in India's first video book, Lord of Records, and she has been bestowed with various prestigious awards like the Leader in the Women and Child Healthcare Initiative at CSR Health Impact Awards, Medical Leadership Award at Indian Health Professional Awards, Inspirational Leader in the Infertility Services, Indian Legends Award, Women Leadership in Medical Science Award, Best Practitioner Award, and many more awards for her academic work as well as her research work. It is an absolute delight to have you with us, ma'am. We welcome you at Jamia Hamdard. Now, I would like to request our chairperson of the Women Development Cell, Dr. Professor Yasmin Shamsi, to address the gathering.
Speaker of the day, Dr. Pooja Diwan, distinguished faculty members, and dear students. Assalamu alaikum and a very good afternoon. I am delighted to welcome you all in this awareness program. I'm extremely thankful to Dr. Pooja Diwan, Senior Consultant and Gynecologist at Apollo Fertility Center, to accept for delivering a lecture on a very important topic of self breast care and breast cancer awareness. Breast cancer, as we know, is one of the most critical health issues impacting women around the globe. It is rapidly rising amongst women in urban areas, and it is the most common cancer in India, having overtaken the cervical cancer. In cities like Mumbai, Delhi, Bengaluru, Kolkata, and Chennai, breast cancer accounts for 25 to 32% of all the female cancers. Of the cancer, of all cases of cancer are in the age group of 25 to 50 years. Due to ignorance, fear, and social stigma, more than 70% of the cases present with stage 3 or stage 4 cancer, which require surgery and extensive treatment and has low survival rates. The only way to change these numbers is by increasing awareness. Breast cancer's chances of survival are higher if it is detected in time. The simplest way to breast cancer prevention is by being able to do self breast examination. It is a privilege to hear from Dr. Pooja Diwan today, who will enlighten us about self breast care and screening for early detection and prevention of this most common women cancer. This will not only improve our understanding of the condition, but we will be able to help others too. I once again welcome you all in this event. Thank you.
Thank you so much, ma'am. I welcome our distinguished speaker, and since it is an online event, we can just give her a big round of virtual applause and welcome ma'am.
Thank you so much. It is indeed a heartfelt opportunity and a pleasure to be associated with Jamia Hamdard University, of which I am incidentally an adjunct professor of this university as well. Professor Yasmin Shamsi has spoken so lucidly about breast cancer, its epidemiology, its importance, that I would therefore quote her quite a few times during my talk. And thank you so much, our pretty show host, for introducing me and giving me this opportunity. So, breast cancer, as we all know, is today the most important cancer and the maximum affecting cancer as a leader to women. So, if there is one cancer which affects women the most, it is breast cancer. As rightly mentioned by Professor Shamsi, cervical cancer used to be the number one cancer in India, overtaking breast cancer, while the rest of the world's leading cancer amongst women was breast cancer. Today, we have also got back to the same statistics where India's number one affecting cancer amongst women is breast cancer, and number two as a female cancer is cervical cancer. Possibly the reasons for that quoted are the kind of westernized lifestyle we are all adapting to, like it is in the rest of the world, and also probably because cervical cancer was affected by a particular virus, and we have uh, put in a vaccine for prevention of cervical cancer, while for breast cancer no vaccine exists. Also, there is a screening test of pap smear, which we do for cervical cancer, which is very rampant, and practically every doctor is offering opportunistically to every woman who is there. But for breast cancer, even if opportunistic, it is not as simple. You have to have a machinery, you have to have a X-ray system where you could do a mammography, etc. But still, if we have a problem, we need to find a solution. Before I embark on the know-how knowledge about breast cancer, let me share with you that I am a breast health campaigner for a long time and have been initiating talks as well as assimilated videos on my YouTube channel, which is Dr. Pooja Diwan Gynae Chat. I repeat, Dr. Pooja Diwan Gynae Chat, and I don't spell my name as Pooja. I spell it as Puja, and Diwan is Dewan. Gynae Chat, Gynaechat. Maybe our anchoress and the show host can type that in the window box. Dr. Pooja Diwan Gynae Chat. The reason I'm saying so is, of course, this is a recorded session. You can listen to it, but there is much more than what I would be able to cover within an hour. So, through this endeavor of being a breast health campaigner, I have now joined hands with an NGO called Sparsh. So, I campaign for breast. People donate for my work, which I'm projecting. The proceeds of the same go to the NGO Sparsh, which focuses on only one thing. It focuses on providing meals, what you call as a meal drive, for the needy, poor, hungry people, particularly children, be construction site workers or laborers at sites or migrants or even old age homes and night shelters. I would now request the show host to kindly play the video. Sharing is caring. Giving a little is better than not giving at all. Hi, this is me on a different note today. I, Dr. Pooja Diwan, your gynecologist, IVF specialist, and a laparoscopic surgeon, is back here with you today. You must be listening to my health talks on my YouTube handle, Dr. Pooja Diwan Gynae Chat, and enjoying the music on my other YouTube handle, Dr. Pooja Diwan. Somewhere down the line, my medical profession's nobility has propelled me into selfless philanthropic social service at the grassroots level. Breast cancer is the leading cancer amongst women in India and the world. I have been an active campaigner for breast health, and I have showcased my work towards the end of this video. Now I have joined hands with Sparsh and NGO for breast self-care and breast cancer awareness campaign to raise funds for the underprivileged and the destitute. Sparsh is a long-standing credible NGO who conduct meal drives to feed the hungry, needy, homeless people who've been starving day after day, particularly catering to the marginalized and the lower segment of the society like the construction site workers, daily wagers, laborers, and even the needy in the old age homes and night shelters. Giving is not just about making a donation. I believe that small acts of kindness can make a big difference. Fundraising is, after all, a tool to achieve a collaborative dream. Every small support towards a good cause matters. I sincerely urge my fellow beings to give donation, charity, by any of the means, be it e-cash, check, online bank transfer, or Google Pay. The links of that are mentioned in the video here as well as in the description of this video. But do not forget to put in as remark my name, Dr. Pooja Diwan, in your transactions which are online transfer, check, or Google Pay. Also, do share with me a screenshot of your transaction details on my personal mobile 99999 or on my email pujadewan2006@yahoo.com, poojadewan2006@yahoo.com. I repeat, do not forget to mention as remark my name, Dr. Pooja Diwan, in the transaction slip. All donations will get benefit of exemption in taxation under Section 80G. Also, all the donors have to share their name, transaction details, PAN card, email, phone number, address, and put in a remark with my name, as well as send me a screenshot on my mobile 99999 of the transaction details. Think Pink is an impetus to bring breast cancer to the forefront. There can be life after breast cancer, isn't it? However, early detection is a prerequisite. Here's to share and authenticate my work through my videos on my YouTube channel, Dr. Pooja Diwan Gynae Chat. And here you go. Breast cancer. Prevention, screening, risks and symptoms. स्तन का कैंसर. लक्षण, कारण और इलाज. कब, किसे और क्यों. बढ़ते खतरे और बचाव. ब्रेस्ट केयर. ब्रेस्ट लंप. स्तन में गांठ. स्तन में गांठ के शुरुआती लक्षण, कारण और इलाज. Link to all the videos that I have mentioned is there right below in the description, and some of them are there on the end screen as well as in the cards. Furthermore, there is a video series both in English and in Hindi on breast cancer awareness. Here you go for English. What are the risk factors for breast cancer? How do you reduce the risk of these factors for prevention of breast cancer? Self-help tips to reduce the risk of breast cancer. What are the genetic factors for breast cancer? BRCA1 and BRCA2. Self-breast examination for prevention and early detection of breast cancer. Mammography for screening. Why, when, and how often? Early warning signs for detection of breast cancer. Breast cancer treatment, chemotherapy, radiotherapy, and hormonal treatment. And then we have videos in Hindi. स्तन की देखभाल का सही तरीका. मैमोग्राफी टेस्ट क्या है? मैमोग्राफी कब, क्यों और किसके लिए? स्तन कैंसर के कारण, स्तन कैंसर का इलाज. And then comes the unique case study of a bold celebrity, Angelina Jolie. And we also have a video bank on breastfeeding. स्तनपान एक ईश्वरीय देन. The journey of challenges of mother and child. The joy of giving is real. No matter where and what way you decide to give. Feel it, cherish it, awaiting a positive response. There is ambient noise coming from somebody's link. Please mute your mics. Thank you for the patient listening to this video. And I would also request our show host to put in a link of this video in the chat box for people's convenience in case they want to access the 25 odd videos on breast self-care and breast cancer. There are about 25 odd videos on breastfeeding alone. Also, in anybody wants to contribute, they're more than welcome. They can go through this video. Coming to our topic. My first question. Somebody's audio is on. I'd again request, please put it on mute. Please be careful. It disturbs everybody and disrupts the thought process. So my first question is, when we talk about a cancer, we are very interested in knowing, am I going to be affected by it? What are my risk factors? What is it that I can do that I could prevent this particular cancer? So we go about it sequentially. My first question that I raise to you would be, what are the risk factors? When it comes to risk factors, we must understand that the risk factor isn't all about westernization, but it's also about certain things with genetics, certain things which are in our hand, certain things which are environmental. So let's look at what really is not in my hand. Those people who get breast cancer have been found to have early age of menarche. That means the early age at which we start our periods. So this is one factor which is not in our hands. Late age of menopause, that is the age at which we finish our periods, is again not in our hands. Then comes breastfeeding as a collaborative effect on breast cancer. Do you know women who breastfeed have much lower chance of getting breast cancer? So no matter how busy you are, no matter how modern the world is, breastfeeding, besides of course giving you satisfaction as a mother and giving you your baby the most important nutrient, that is your breast milk for development, is also something which is going to protect you from breast cancer. Equally, there are women who simply never breastfeed. They are at high risk. Those who breastfeed for a very short duration of time are at high risk. And there are some women who never become a mother, who are childless. So obviously the question of breastfeeding doesn't come. So if your age of menopause is late, if the age of your starting of periods is early, if you do not breastfeed or you breastfeed for a very short time, or you simply don't have children, these are all risk factors for breast cancer. Then of course there is environment, there are chemicals, there are preservatives, there is radiation, which may not be completely in our hand. But we also have factors such as obesity. Obesity has been associated with breast cancer, not directly, as in it does not have a causal relationship, but it certainly has an association. Then comes genetics. When it comes to genetics, we could inherit those genes from our mother's side. We could also inherit the genes from our entire family side. So it's not just a mother, but there could be familial causes also, which could come from even your father's side. So let's understand what it is. So there are two very important genes which are known as BRCA1 and BRCA2. I'm not teaching you science or medicine here. But why I'm trying to tell you is that if somebody has this gene called BRCA1, there is 80% chance that that particular person during her lifetime, 80% chance, mind you, that that particular person during her lifetime is going to get breast cancer. And it's not just that, but during that person's lifetime, there is also 40% chance that she is going to get breast cancer in her ovarian cancer in her ovaries. So if you have a gene which exposes you to 80 plus 40, nearly 120% chance of getting a cancer of breast or ovary, you're sure going to be concerned about it. Equally, there is BRCA2, which is less of the devil, but yes, it is still a criminal, still a devil. In this, your breast cancer chance instead of 80% is 40, your ovarian cancer chance instead of 40% is 20. But still, there is a 60% chance of getting a cancer, which is no less. So when there is a cancer, like a breast cancer running in your family, do not take it lying down. We may not have the details about the genetic workup of that particular individual who has developed breast cancer. Sometimes the person is not amenable to discussion. Sometimes the person does not want to share. But if you know that that person in your family and that person particularly is from your mother's side, this gene could be running. So either you motivate that person to get the test done, or retrieve the information from that person if the person has got it done or is knowledgeable about it. If not, you go and get your own test done. That relieves you from the genetic risk, and it is not infrequent, it is pretty high. So let's understand what and who are the people who could be genetically involved with giving you a risk. For example, if your mother has breast cancer, or your mother's mother, that is your maternal grandmother, Nani, has breast cancer, or your mother's sister, that is your Masi, has breast cancer, or your own sister has breast cancer, or your own daughter has breast cancer. These are all direct blood relationships. They will all be categorized as first degree relatives. In first degree relatives, your chance of getting breast cancer is way higher. But supposing it is your granddaughter who has developed breast cancer, it is your great grandmother who has developed breast cancer, or it is your first cousin who has developed breast cancer, these are all second degree relatives. And these second degree relatives will have lesser chance of passing it on to you. Still, you should go and get your genes tested. Now comes the third thing. What is it that I can do by myself to prevent? Yes, I told you the risk factors, half of which were not in our control. I told you genetic factors which are simply not in our control, but the screening of those genetic factors is there. Then comes taking care of our own self, that is our own breast care. Now the question is, when should I start taking care of my breast? When should I start examining my breast? So taking care of your breast is a softer word. The correct word to use is to examine your breast. So first we will talk is when to start examining, how frequently to do that, and how to do it. So the moment you're 18 years of age, you start examining your breast till the time you're alive. Now the question is how frequently. You do that every month. When do you do it? You do it about 3-4 days after your menses have finished. That's the best time to examine. Then comes the question that how am I supposed to examine? See, you have your own hands. Your hands have palm. Your hands have finger. The right way to examine is to try and examine with your palm. And you have seen how we knead the flour, the flour, the wheat flour. जो आटा है हम गूंथते हैं, तो जब हम आटा गूंथते हैं तो जो हमें फील आती है, जब आटा गूंद रहे होते हैं तो शुरू में उसमें डेले होते हैं. वो डेले अगर आपको फील होते हैं तो आप डॉक्टर के पास जा सकते हैं नॉट्स के फॉर्म में. तो आप कैसे एग्जामिन करेंगे? यू विल एग्जामिन सिटिंग ऑन द चेयर, you will examine lying down, you will examine standing up, you will examine yourself standing in front of the mirror, you can examine yourself standing while in the shower, you can examine yourself with your hand up like this. Okay, so when you examine, there are two broad areas to examine. One is the breast per se, and the other is the nipple and the darker area around it called the areola. When you examine the breast, you try and feel it with the palm, not with your fingers. Okay, you try and feel it with the palm and not with your fingers. So when you are examining, you are going to examine from the outermost area to the innermost area, from the topmost area to the down area. You will never forget to also examine your underarm, that is the axilla or the armpit. Okay, if you feel that there is something hard, something knotty, some lump, something which is moving from here to there, something which is like a lump but it is attached to the skin, something which is a lump which is not attached to the skin, some area of the breast which is giving you pain, something which is making you feel that your breasts have become abnormal in shape. So when you stand in front of the mirror, you observe. You observe what? You observe that your breast has become smaller than the other breast or larger than the other breast. Has your breast become distorted compared to the other breast or by itself? Is there any redness or any itching or any crack or any breach in the integrity of the skin or any ulcer or any wound kind of a thing? You also look at your nipples. When you look at your nipples are supposed to be protruding out. In case they are protruding in, but they were earlier out, or their direction also instead of center has become distorted to right, left. And finally, you have to also press the base of the nipple and see if there is any liquid coming out of it. In case a liquid is coming out, you have to look at the color. Is it white, cream, green, red, brown? There are so many colors. Okay, so these things are important. So in case you find any abnormality of this kind, you report to the doctor. You examine your breast every month. Now, when you have been examining your breast, every 3 years you can go to the doctor, even if your breasts are normal, to get it examined clinically by a doctor. So besides you, even your doctor is examining. But even if a doctor has to find out anything abnormal happening with their own fingers, they can pick up only 40% of the lesions. They can't pick up everything. Because some things can be palpated with the hand, but some things cannot be felt with the hand. They are so microscopic that you need machines to detect that. And the machinery that we use and the tests that we do is a mammography. The machine is mammogram, the test is mammography, and because we do it for both the breast, it is known as bilateral mammography. Now, in this test, first question is, when do I start doing mammography? And till what age do I start doing mammography? So as usual, there are different schools of thoughts. Those thoughts stem out of different colleges, which are the constitutional bodies, directorial bodies, which give directives about good practice guidelines, and they are different for different countries. But broadly speaking, once you turn 40 years of age, you should get your mammography done. Till when? Again, there are different schools of thought. One says till the age of 65, the other says till the time you're alive, the third says 10 years before the average life expectancy of your population you could stop. So now the safe way to go about it is from the time you turn 40 till the time you're alive. Now the question is, when I have told you, how I have told you, but how frequently to get it done. So frequency is very simple. Again, in countries like US of A, where the frequency is very high, they advise mammography every year. In certain countries, they advise it every 5 years. In certain countries like UK, which are government driven, social system driven, socially funded by the government through the NHS, they say every 3 years. So even if we come to somewhere in between, at least get it done every 3 years, if not every year. Okay. Now, what is mammography? You have to bare yourself. You have to remove your undergarments. You have to stand next to a machine where between two plates which are made of glass or plastic, okay, your breast is placed and it is compressed. And 2 x-rays of each of the breast is taken. So there are 4 x-rays which are taken. Mind you, mammography is not a game that I'll get up anytime and go and get a mammography done. Mammography is not 1 x-ray, it is 4 x-rays. Overdoing a mammography or doing a mammography when it is not the right age group, when it is not mandated, is no fun. Because instead of 1 x-ray, you're exposing yourself to 4, and cumulative x-ray exposure itself can trigger breast cancer. So it has to be followed just the right way. Now, in case in your family, breast cancer is running, and you have an idea that breast cancer is running in your family, then you start getting your mammography done from the age of 35-40. If it is in 20s, what should you do? So in case you have the information of the age group of the person who was detected with breast cancer and at what age of that person was breast cancer detected, then 5 years before that, mind you, I repeat, 5 years before that, you start doing your mammography. So in case your relative, first degree relative, got breast cancer at the age of 30, you can get your mammography done from 25 onwards. Otherwise, you get it done at 40. In case you don't know the age at which the other relative had breast cancer, you can start off at 35. This is what it is broadly. There is so much variance. The next question that people ask me is mammography painful? When you compress something, even if gently, there is pressure discomfort. It is not painful. So a lot of women will tell you and quote, oh, it was so painful, I'm not going to get it done. But if femininity is all about having breasts, as the conventional thought process goes, Would you want to lose them to a little discomfort? I don't believe femininity is about having breasts or about having a uterus or about reproduction. But yes, within the society, there are a lot of people who attribute certain features to femininity. If they matter, which it should, as an important organ of your body. You know, when we get a uterus removed, a lot of people say, oh, it's okay, I have finished having babies, I really don't need a uterus. Well, there is no justification to that either. But in case of breasts, whether you've completed your family, you still don't want to lose your breast, right? So be watchful of what I'm saying. Then comes another factor that we've talked about, familial hereditary breast cancers. Now, why am I talking of it? You know, there are families where somebody has an intestine colon cancer, somebody has pancreas cancer, somebody has prostate, which is a male cancer, somebody can have a brain cancer, somebody has a breast cancer, somebody has an ovarian cancer. So it's a cancer which is running within the family. Family doesn't mean 4 people of the family, but a broad family as well. And if that is running within the family, even breast cancer can, some male could be affected, female could also be affected. A male specific cancer like prostate cancer can happen, a female specific cancer like breast and ovarian, even uterine cancer can happen. So we need to have a know-how about this. Again, for this, today we have beautiful panels of genetic testing where we can simply run a test for about 10-15,000 rupees and we can get a personal genomics, your personal gene testing about what is your lifetime risk of having cancers of these particular categories and even so many other problems. So these things really matter. So in case something like that is happening in the family, again, it needs to be taken under question. Now, the next question is that, okay, I got a mammography done and there was some distortion, some calcification, something which was found there. What should I do now? Well, you go to a breast specialist doctor. If not, you go to a gynecologist. They will guide you. Again, in mammography, there is a scoring system. It starts from 0, 1, 2, 3, 4, 5, 6. 0 means there's no problem. 0 means that we have not been able to see properly inside your breast. We need support of another investigation to give you a clearance. 0 doesn't mean you don't have breast cancer. Stage 1, BIRADS 1 means you don't have breast cancer. And BIRADS 6 means you have frank breast cancer, no doubt. So 0, 1, 2, 3, 4, 5, 6. What happens is, so many of us get a test done. Mammography report says BIRADS 0. We are so happy. It's 0. It is clearly written. We've not been able to see the breast properly because of the density of the breast, because of the lights which were supposed to go through the machinery into your breast. Please do an added investigation. We are so pleased that it is 0 that we forget about any other action beyond that. So it's only 1 as a situation where you don't have breast cancer. 2, 3, 2 and 3. 2 is usually a condition where you could be having a lump or a lump-like situation or dense breast, which are usually age-related things. Like you have fibroids in the uterus, you even have fibroids in the breast, which is known as fibroadenoma. So it falls in stage 2 because there's hardly 3% chance that you will get a cancer in that fibroid. And then there are fibrocystic changes, which are age-related changes. 3, 4, and 5 have high risks. Obviously, 5 has way higher risk. And in those situations, it is possible that your breast specialist sends you to another intervention breast specialist who puts in a needle into that lesion, that lump, that area, and pulls out a tissue through a biopsy needle and sends it for testing. If that comes out to be positive, then it is breast cancer. If not, it is not. And when we want to say, you must have heard, what stage is the breast cancer? So there are stages. Again, stages can start from 0 to 5. 1, 2, 3, 4, 5. As obvious, 1 is lowest and 5 is highest. The lower the stage, that is 1. Again, 1 is also ABC. Why I'm talking about this, you must be wondering. The lower the stage, earlier you are able to detect it. That is stage 1. You almost have a 90% plus survivability for so many years to go. Your 10-year, 15-year survivability is to the tune of 90%. And it's only 10 years that I'm talking. There's a 20-year survivability of more than 80%. So you're practically going to have full, lifespan. So amongst the cancers, actually breast cancer is not that terrible a cancer. It can be prevented. It can be early detected. It can be early treated. And it can give you a long survivability. And there are certain stages which are pre-cancer stages, which fall in that carcinoma in situ, what I'm trying to say, a stage 0. Even when that kind of a stage comes, or very early stage 1A of breast cancer comes, in these stages, you must have heard they got cancer, then they had to undergo chemotherapy, radiotherapy. Chemotherapy means a lot of medicines, hot injections are given through IV lines, and women lose hair, they become bald, then they have to wear wigs and all those and scarves and stuff like that. Maybe you have heard of it. Yeah, but then there is radiotherapy. Radiotherapy means there is a big machine in front of which you are placed, and exactly where your cancer is, a targeted beam of light is sent, and that targeted beam is going to kill the cells at that point. It is not going to touch you, it's not going to penetrate you, it's not an injection, it's not a knife. It's just a beam of rays coming to that point on your skin. So there is so much difference. In chemotherapy, you lose hair. But if it's early stage 1 or it is pre-cancer, you don't even have to undergo chemotherapy. You can directly go for radiotherapy and your hair loss and problem is also saved for. So early detection gives you huge survivability issue as well as this. And also, if it's early detection, it's just a little microscopic piece which needs to be removed. Or it's a small little lump or a gant, what you call it, which needs to be removed. You don't have to remove the breast in toto. You don't have to do a radical dissection and remove the stuff which is below your underarm, those lymph nodes. You don't have to distort and, partly cut away the breast. You don't have to do radical surgeries. It's just as though I had a little cut here and a little piece was removed and one stitched again. It looks exactly the same. No mass loss, no look loss, hardly stitch is visible. But if it's a big lump and the staging is such that we can remove the lump and part of the breast can be reconstructed, in the very same sitting as the surgery. That trauma of having a distorted or a half breast or having a completely breast removal is no longer there. We always have to involve plastic surgeons who know how to do breast reconstruction. So if only a part of the breast is removed, we can actually take the skin from behind our back, where we get tires. From that area, we can take the skin and we can move it further and reconstruct it, and beautifully reconstructs. Even if the nipple has to be removed, it can be beautifully reconstructed with certain other darker tissues of the body. And in case the entire breast has to be removed and there is so much of tissue loss, where do we bring the breast tissue from? Then we put a prosthesis. Prosthesis is a piece. Like you must have heard, I fell and I got a plate in my hand. I fell, I broke my hip. They put a plate or a ball valve, a metal, this kind of a thing. We don't put any metals. We put very soft things. You must have heard of silicone material, silicone nipples for babies to feed, silicone pads and stuff like that. So is a very soft, malleable tissue. That tissue is put in the breast and the skin is closed. Nipples can be preserved from the previous breast if not affected and planted back. Nipple and areola, or a new nipple areola can be constructed. Okay, and for darkening it, you can do tattooing, pigmentation, and there is so much more you can do. So the negativity of the disease, where there is no breast reconstruction and the lady is traumatized and she has to wear undergarments which are, you know, filled with stuff to reconstruct a breast and stuff like that, has also gone away to a huge extent. There used to be a time, if you have a breast removal, you probably have to wait for 4 or 5 years before you can get a breast reconstructed. But today, that very day it is removed. When you come out of the operation theater, you already have a breast in place. Life has changed so much. So there is enough positivity to this disease as compared to the loom. Nobody wants to have a cancer. Forget about the best cancer in this world. But still there is something like that. Okay, I talk about the case of a noted Hollywood actress, Angelina Jolie, which you must have heard of. And she has revolutionized and brought forth to you and me what is the bold and correct attitude towards her disease. You know, her mother, her grandmother, her sister, all three got breast cancer. They got genetic testing done. When they got, all three got breast cancer, they got genetic testing done. When they got the genetic testing done, they found that there was a genetic disorder. That gene, that most dangerous gene, BRCA1, was running in their family. That means Angelina had a 80 plus 40, 120% chance of having cancer. 80% chance of having breast cancer and 40% chance of having ovarian cancer. In that situation, what do you think would have happened to her? She would have been a breast cancer patient. She would have been an ovarian cancer patient. She would be a breast cancer survivor. She would be fighting against it and stuff like that. What did she choose to do? She went and got her breast removed and got artificial breasts. She went and got her ovaries removed but retained her uterus. Now, with the ovaries gone and she's still being young, she needed the female hormones. So what did she do? She took skin patches. Okay, just patch, small patch, which just stick onto your skin, which provide hormones. Today we have insulin patches also. We don't have to take insulin injections. There are insulin patches also. They provide her hormones every day. That is the female hormone estrogen. She needed progesterone also. That she put a small little device in the uterus that is giving progesterone hormone. So she will remain young. If you remove these ovaries, you become before time menopause. That means you're going to grow old. Your bones are going to dissolve first. You're going to have bone breakage. Your skin will become drier, wrinkled, hair dry, nails will break, so many more things. I'm just giving you cosmetic things of it. Your vagina will become drier, having sexual relationship will be problematic, 100 things. But I'm just focusing on what you and I can see of a third person. So she got her breast removed, she got her ovaries removed, she got her artificial breast constructed. She's taking hormone replacement therapy. She's very much there as she was always a philanthropic person. Now she is very much there as a breast cancer propagand. And everybody may not have the boldness, but she took this decision. And she says, well, I have five odd children, which, you know, she has a big family. So she says, I'd rather survive. So this is the whole story of breast cancer per se. Then, you know, when I mentioned to you that there are additional investigations which need to be done, I mentioned to you about the X-ray mammogram, if you remember. And I said there was this zero scoring. Don't sit down and think, wow, I have zero chance, right? You need to get an additional investigation. That additional investigation, a very simple thing. It is ultrasound of the breast. Like you get ultrasound of your tummy, you get ultrasound of the breast. That will give you the information. Now, in case you're a young girl and you have some problem in the breast, please don't go and get a mammography done for yourself. In India, we are all doctors, you see. We are born doctors. So we'll go and get something done, and then we will find out, oh my God, I got a mammography done. Now I'm attending Dr. Pooja Deva's lecture. She says mammography adds to risk of breast cancer. Why did I do it? Now do I have breast cancer? Will I get breast cancer early? Hang on. You should have gone to your doctor. A doctor is not a physician. Doctor is not a medicine doctor. Doctor is not the family doctor you go to. You go to a breast doctor or you go to a gynecologist. They are different people. They will tell you which investigation to do, whether to do MRI, whether to do mammography, whether to do ultrasound. Don't pick and choose of your own. All the information that I'm giving is to be filtered and sieved through the lens of your doctor, through personalized consultation. Let me share with you my number here. This is 9930303438. I repeat, 9930303438. In case you have a problem, you can ask for consultation. The consultation will be a routine paid consultation the way it ought to be, right? You can go through my videos. You can bring up with your personal concern. There is also a problem of just having breast lumps even in young age, you know. Mind you, 80% of the breast lumps are not cancerous, but what about those 20% which are? And in case you have a breast lump, and even if it is not non-cancerous, when does it become cancerous? How frequently should I monitor it? When should I be worried about it? Doctor says get a surgery done. Should I get a surgery done or should I not get a surgery done? I'll repeat my number 9930303438. In case you need a consultation, we can formally do a consultation on a video call and take it beyond that. But I am just trying to focus on breast cancer as a whole, and what I have tried to share: risk factors, genetic risk factors, self-breast examination, mammography, other investigations, scoring on mammography, staging of breast cancer, chemotherapy, radiotherapy, side effects of these two, surgery and its types, radiotherapy and its problems. And then I have talked about survivability and about a particular case. What I have not yet embarked upon is the fact that this particular malignancy, okay, also has certain issues which you need to understand about breast lump, which is not a breast cancer. I have a wonderful video on breast lump in Hindi. You can watch that video. But my take-home message is 80% of the breast lumps are not cancerous. But can I guarantee you, just talking, that you don't have a breast lump which is not cancerous? I can't. Amongst all these things that I have shared, I must bring to your knowledge that the month of October is a breast cancer awareness month. And you might have seen breast cancer treatment offering hospitals lighting up their buildings with a beautiful pink color for that entire month. And there is a ribbon, you know, which we wear on our chest, which is a pink colored ribbon, which you may have seen in my video, which is also a breast cancer support ribbon. Hormones play a huge role in breast cancer. There is, I told you, estrogen hormone, progesterone hormone, etc. So whenever breast cancer happens, besides sending that tissue for tissue testing to the lab, we also send it for hormonal testing, immunocytochemistry testing. For ER, that is estrogen receptor, PR, progesterone receptor, and HER2 receptors. In case any of them are positive, then we need to give to the patient hormonal therapy, even after chemotherapy, radiotherapy. And this therapy can go on for up to 10 years. So you'll wonder, my God, I mean, she was saying things are so simplified, but it's just one little tablet which you have to have for up to 5 to 10 years, depending upon which hormone is positive. You just have to pop it in your mouth every day. So there is a beautiful movie on the research. It's a mainstream line Bollywood movie on the research of this particular HER2 factor, which determines the aggression of breast cancer. I must share with you, there are certain types of breast cancers which happen in both the breast. There are some of them which happen only in one. There are certain breast cancers which will go to the ovary as well. And when breast cancer spreads so much, it can go to your liver, it can go to your backbone, to your spine. That spread of breast cancer is known as metastasis. So all sorts of treatments are available. And I hope and pray none of us cross roads with this particular malignancy. Still, it is lesser of the devils. And we are all now aware and able to understand how self-breast examination will happen. I played that video for your benefit. Again, I will ask the show host to put the link of that particular video. In that video, you would have seen the thumbnails of all the videos that I have, and in the description, I hope you understand what description. In the description of the video, there is a long list of all the videos, and you can yourself understand self-breast examination through those videos. It is difficult to demonstrate so, as you can understand, in a public forum like this. So I took the help of these instruments. Thank you so much, Professor Shamsi, Jamia Hamdard University, my show host, to give me this opportunity. In case there are any questions that you wish to ask, feel free to do so. But before I end this talk, I again will request my show host to play that video for people to be able to grasp what I was saying and can hang on as a take home. It's not a take home assignment, but it's a take home connectivity to the same thought process that I'm talking. And in case somebody wants to donate anything towards this cause, you feel free to do so. Thank you. Dr. Khurshid Ahmed is also here. Finally, I see him on the window screen. Thank you so much. I can't hear you, sir. You're not.
Can I say something?
Yes, please.
Okay. I am Dr. Khurshid, heading the Department of Anatomy in School of Unani Medicine and working in capacity of NSS coordinator of the University, Jamia Hamdard. Really, we are honored to have you here and having a lecture on that very pertinent and important issue, breast cancer, is awareness, and so lucidly you elaborated and explained everything. Thank you very much. Not any query, just it was my was what I felt from my inside. I tried to communicate it to you. Thank you very much.
Thank you
Once
so
again.
much. Thank you so much.
I would like to ask the participants if they have any queries related to whatever ma'am has discussed. Although ma'am has very beautifully explained everything in the simplistic of language which was possible. However, if there is anything you would like to ask, you can unmute yourself or put the question in the chat box.
In case there is any question in the chat box, let our show host read that out to me. And in case you ask me, then you ask me directly.
Okay, Hera, if you have a question, please go ahead.
Good afternoon, ma'am. I wanted to ask that silicone implants, are they really feasible? And if there are chances of bursting, are they going to cause any more complications like in the breast?
So if in case you are putting up a question for all those women who decide to go for increasing the size of their breast, even though they are not patients and just want to undergo augmentation mammoplasty is what we call it, then also silicone implants are put. But here we are talking about breast cancer patients, and we are putting silicone implants there. Well, of course, there is liquid inside of it, and they can in rare perchance burst. Those good old times have really gone by, but then in case anybody was to put that implant, they will certainly take a consent and a signature of awareness of the complication. So things like that can theoretically exist for sure.
Thank you, ma'am.
Ma'am, there is another question from one of the participants. She wants to ask that if what is your opinion that can exercise make it less prone for an individual to get breast cancer? What is
Not
the
really.
role?
I didn't mention that.
Okay, so probably the role of exercise is post diagnosis, but not in prevention.
There's no role of exercise in decreasing the risk of breast cancer. Either post or pre or whatever.
However, those patients who are diagnosed with breast cancer, once they have undergone their chemo, radio, and surgery, so at that time, it is recommended that they maintain an active lifestyle and they indulge into physical activity so that their chances of recurrence reduce.
Absolutely not. एक्सरसाइज हम इसलिए कहते हैं ताकि एक्सरसाइज इज एन एड्रेनलिन पंपर, राइट? इट गिव्स यू हैप्पी हार्मोन्स. तुम्हारा दिमाग डिस्टॉर्ट कहीं डिकेट करते हैं, तुम्हें खुशी देते हैं, हैप्पी हार्मोन देते हैं, कुछ करने को होता है. नहीं तो वही चीज के अंदर लगे रहेंगे कि मेरे साथ क्या हो गया क्या हो गया. पर ऐसा कहना कि एक्टिव लाइफस्टाइल क्यों नहीं लीड करना है? एक्टिव लाइफस्टाइल का मतलब एक्सरसाइज करना तो नहीं होता. और अगर आप एक्टिव लाइफस्टाइल में एक्सरसाइज इनकॉर्पोरेट करते हैं तो बहुत अच्छी बात है. बट क्या उस एक्टिव एक्सरसाइज से आपकी ब्रेस्ट कैंसर रिपीट नहीं होगा, रेकरेंस नहीं होगा या कभी नहीं होगा? ऐसा कुछ भी नहीं.
So means it was a myth that exercise are good women who were efforts in physical activity, especially the rural.
Sir, your voice is echoing.
Am I audible now?
Yes, now it's better.
Okay, ma'am. So it was a myth what we used to hear that the women who is indulged in more physical exercises has lesser chances of getting a cancer of the breast. So it was a mythology.
See, uterus cancer is associated with a triad of features, which is hypertension, diabetes, and obesity, which is metabolic syndrome. Okay, and in those cases, when you are more obese, okay, when you are more obese, you produce more estrogen hormones, which can trigger uterus cancer by increasing the thickness of the lining of the uterus cancer. There, you should not be obese. इट इज अ रेट्रोस्पेक्टिव डायग्नोसिस. इसको यूट्रस कैंसर हो गया और हमने ऑब्जर्व करा कि उसको डायबिटीज भी थी, ब्लड प्रेशर भी थी, ओबेसिटी भी थी. बट क्या ओबेसिटी यूट्रस कैंसर कॉज करती है? आंसर इज नो. इट इज एन ऑब्जर्वेशन, it is an association, but it is not a causal factor. There is a difference. Mind my words. Is there a causal mechanism? No. Is it an associated factor? Yes. There's a difference. Does obesity cause uterus cancer? No. Is this observed amongst them? Yes.
And ma'am, one of the participants has pointed out that exercise can somehow help in maintaining the hormonal balance. So, for those patients who have breast cancer because of the hormonal predisposition, so probably indirectly physical activity or exercise.
I think the questions being asked are highly inappropriate. I will close this matter. That exercise, hormonal imbalance, what hormones? We have 50 hormones. Which hormone are you talking about? Which imbalance are you talking about? We can shoot in the air the question, but your answer has to be very clear. And I have given it repeatedly. So we will not entertain any more exercise questions because I've already given an answer. If there is a new question, please throw that question to me.
Okay, I would like to ask the participants if they have any other queries, they can put it ahead in the chat box. Okay, you can always reach out to ma'am. She has shared her YouTube channel as well as her personal number for consultation.
And you're requested not to call me. Please put in a message in WhatsApp in case you have an issue.
Yeah, and it will be advised that you can just text her, then she can find an appropriate time to get back to you. Thank you, ma'am. I think we'll end this session with a vote of thanks. Thank you so much for sharing your valuable inputs on this important topic.
I request you to just flag the YouTube link to them as well as the name of my YouTube channel and play the video again for the benefit of those who were late joinees, which were quite many.
Sure, ma'am. I'll do that.
मुझे बस एक चीज बोलनी है, नानू को उनसे क्या प्रॉब्लम है, आज वापस सुना दिया अभी नीचे।
Is scared. Hi, Dr. Pooja Diwan, your gynecologist, IVF specialist, and a laparoscopic surgeon, is back here with you today. You must be listening to my health talks on my YouTube handle, Dr. Pooja Diwan Gynae Chat, and enjoying the music on my other YouTube handle, Dr. Pooja Diwan. Somewhere down the line, my medical profession's nobility has propelled me into selfless philanthropic social service at the grassroots level. Breast cancer is the leading cancer amongst women in India and the world. I have been an active campaigner for breast health, and I have showcased my work towards the end of this video. Now, I have joined hands with Sparshan NGO for breast self-care and breast cancer awareness campaign to raise funds for the underprivileged and the destitute. Sparsh is a long-standing credible NGO who conduct meal drives to feed the hungry, needy, homeless people who've been starving day after day, particularly catering to the marginalized and the lower segment of the society like the construction site workers, daily wagers, laborers, and even the needy in the old age homes and night shelters. Giving is not just about making a donation. I believe that small acts of kindness can make a big difference. Fundraising is, after all, a tool to achieve a collaborative dream. Every small support towards a good cause matters. I sincerely urge my fellow beings to give donation, charity, by any of the means, be it be cash, check, online bank transfer, or Google Pay. The links of that are mentioned in the video here as well as in the description of this video. But do not forget to put in as remark my name, Dr. Pooja Diwan, in your transactions which are online transfer, check, or Google Pay. Also, do share with me a screenshot of your transaction details on my personal mobile 99999 or on my email pujadewan2006@yahoo.com, poojadewan2006@yahoo.com. I repeat, do not forget to mention as remark my name, Dr. Pooja Diwan, in the transaction slip. All donations will get benefit of exemption in taxation under Section 80G. Also, all the donors have to share their name, transaction details, PAN card, email, phone number, address, and put in a remark with my name, as well as send me a screenshot on my mobile 99999360009 of the transaction details. Think Pink is an impetus to bring breast cancer to the forefront. There can be life after breast cancer, isn't it? However, early detection is a prerequisite. Here's to share and authenticate my work through my videos on my YouTube channel, Dr. Pooja Diwan Gynae Chat. And here you go. Breast cancer. Prevention, screening, risks and symptoms. स्तन का कैंसर, लक्षण, कारण और इलाज, कब, किसे और क्यों, बढ़ते खतरे और बचाव. ब्रेस्ट केयर, ब्रेस्ट लंप, स्तन में गांठ, स्तन में गांठ के शुरुआती लक्षण, कारण और इलाज. Link to all the videos that I have mentioned is there right below in the description, and some of them are there on the end screen as well as in the cards. Furthermore, there is a video series both in English and in Hindi on breast cancer awareness. Here you go for English. What are the risk factors for breast cancer? How do you reduce the risk of these factors for prevention of breast cancer? Self-help tips to reduce the risk of breast cancer. What are the genetic factors for breast cancer? BRCA1 and BRCA2. Self-breast examination for prevention and early detection of breast cancer. Mammography for screening. Why, when, and how often? Early warning signs for detection of breast cancer. Breast cancer treatment, chemotherapy, radiotherapy, and hormonal treatment. And then we have videos in Hindi. स्तन की देखभाल का सही तरीका. मैमोग्राफी टेस्ट क्या है? मैमोग्राफी कब, क्यों और किसके लिए? स्तन कैंसर के कारण, स्तन कैंसर का इलाज. And then comes the unique case study of a bold celebrity, Angelina Jolie. And we also have a video bank on breastfeeding. स्तनपान एक ईश्वरीय देन. The journey of challenges of mother and child. The joy of giving is real. No matter where and what way you decide to give. Feel it, cherish it, awaiting a positive response.
I'm calling you 5 minutes.
Yes, ma'am, it was a lovely video, and I'm sure the students would be able to get all the information from the videos you have mentioned in the coming video of yours. Now I'd like to request Dr. Sohrab Ahmed Khan, Associate Professor, Jamia Hamdard, to deliver the vote of thanks.
Thank you, sir. I'm privileged to submit my vote of thanks. First of all, I would like to thank our Honorable Vice Chancellor, Afshar Alam Sahab, for giving us free hand to organize such kind of informative lecture. Secondly, I am very much thankful to Dr. Pooja, who has chosen very relevant topic for the 50% population of the whole India, not 50%, but the whole 100%, because all the men are dependent on the women, okay? And our women will be healthy, then men can be healthy. So thank you, Dr. Pooja, for choosing this very relevant topic for our youngster and middle-aged women, because this problem is becoming very common nowadays, okay? And also, I'm thankful to our chairperson of the Women's Cell, Dr. Yasmin Shamsi, who is always encouraging us to plan such kind of informative activities. I'm also thankful to all the staff of Jamia Hamdard for attending, and students for attending this beautiful lecture. And especially I'm thankful to Mr. Pandey Sahab for providing us constant support whenever we are requiring for online lecture of this kind of things. Thank you, ma'am. Thank you again for sharing beautiful knowledge with us and our students. And I hope we will come to you shortly. I will take your services again for such kind of activity. Thank you, ma'am.
Thank you, Dr. Sara.
Thank you, ma'am.
We log out?
Yes, ma'am. Thank you.
Thank you, everybody. Bye-bye. Take care. It's World Health Day, which we didn't mention, but wishing to you all a good healthy life, and more than that, a healthier lifestyle. As they say, it's not about fixed deposit of money, but it's about fixed depositing in your health through exercise and your physical well-being. Thank you so much. Ciao.
Thank you, Khurshid sir, for joining and for being there throughout. Thank you so much. Thank you, Yasmin ma'am.
मैम भी हैं चलो
Thank you all for inviting me.
Thank you, Dr. Sahar, Dr. Surab, Dr. Khurshid, and all you who have attended this wonderful lecture. Thank you so much.
Thank you.
सर भी आ रहा हूँ उसको लगाना